everyone, my name is Amisha Poojari and I am thrilled to be sharing with you guys today a little bit about the issue of healthcare and specifically access to basic healthcare for all. First off, here's a little bit about me. I am a rising sophomore at MICS, which is in St. Louis, Missouri. You can find me on Instagram at Happy Elephants. And that being said, I love elephants. I also love to learn about math and science and also global learning by traveling the world and experiencing new cultures and new perspectives that I can apply to my everyday life. First off, here's a little bit about the issue. There are around $500 billion being spent yearly towards healthcare. And yet it is sad to see that still 400 million people lack the basic healthcare resources that they need. That is around 6.7%. And this is sad to see because as good as it may be to progress towards the future with medical innovations, technologies, cures for diseases, more faster ways to diagnose diseases, it is not right to leave such a big portion of us behind. So we should find a middle balance in between that to spend money towards the people that still need resources while still be able to progress towards the future at the same time. Health finance has become a big issue, which has also been pushing people towards poverty. Around 10% of expenses in a household head towards healthcare, and yet still 100 million people are unable to afford that. So this really places us as healthcare future doctors and future nurses to really think about whether we want to prioritize life or money. This is a country care chart, and from this we can see that several of the developed nations like the US, UK, China, Russia, Canada, all of them, they are doing well, and the percentage of poverty is ideal, less than 10% at this point in time. Yet after COVID, even they were affected. Around 500,000 people were added onto this percentage. In underdeveloped countries such as Myanmar, many in sub-Saharan Africa, India, and Nigeria, there has been always a very high rate of poverty, around 50%. And after COVID, we can only imagine, but the increase is 124 million. Overall, there has been increased food famines, less access to healthcare resources, and especially vaccines and treatment for COVID. That has brought the already big 9% percentage of extreme poverty to 11.4%. And this is not good because we had a 2030 agenda that was mainly to bring that 9% as close to 0%, possibly less than 3% as possible, and now we've just increased to 11%. This is a chart of the top 10 countries that were affected by COVID, and you can see the rise in poverty in multiple of these sub-Saharan African countries. And as said before, this is really going to impact us as we head towards the 2030 agenda. Some other current issues, along with COVID, as we've just discussed, with the 2030 agenda being impacted, the inability to provide vaccines and medications, and also the economical roadblock in these underdeveloped countries, as they're not able to receive funds that can get them the vaccines and medications to provide to their people. The Ukraine crisis brought 70 million people into poverty, most of them being refugees. Around 8 million of those people lacked food security because of that. And now this has not only affected many of the surrounding countries in Ukraine and Europe, but also has had effects in Latin America. And finally, the Roe v. Wade court case has put women in a horrible situation, especially for those in poverty. They are struggling to control big family sizes as they don't have the money to provide for them. And access to abortions has become more expensive and even more distant now as they've become illegal. So when women are really determined that they cannot provide for a family, they're somehow going to get an abortion, which can be a very unsafe one, and harm their own health at the same time, which can result in more deaths and make a really hard situation of whether they could struggle with their own health or with providing without being able to provide for a new family. This is poverty as not just a simple issue that came up a few days ago and will go away. It's not like that. It could have effects on a lifetime, and it really depends because so many children, so many people spending so much time working, physical labor, and not being able to go to schools, go to workplaces, are being deprived of the opportunities to learn and become the best people they can. Some of these children could have been the world's future great leaders. We would have no idea. But of course, every problem does have a solution, and first, here is whose solution. The World Health Organization has started providing universal health coverage, and the goal is that by 2023, around 1 billion people will at least have heard of it and be benefited in the smallest way as possible. Their main goal is stressing healthcare as a human right, not just a luxury for people with money. And also, they've started aiding underdeveloped countries to set up foundations of hospitals and healthcare facilities so that they can build on and start providing medical attention to the people in their country. And currently, 75% of national health policies are directed toward this goal. It is also important for each nation to decide and determine policies that encourage hospitals and healthcare businesses and facilities to make healthcare more accessible, whether it's in the transportation for emergency needs or just locations. Of course, I have a solution as well. It is HOPE, the humanitarian organization to end poverty once and for all. Our three main goals are publication and awareness, aid we receive, whether it's funds, volunteers, or people, and the aid we provide, which is what we use with the funds and the people that we are getting that are supporting us to provide the basic need kits and educational tutoring for children that are really desperate to learn, and just service in any way possible that we can. And this really illustrates that the future is in our hands for us to join together and make the difference that we want. Of course, so this is the map of our goals. Right now, I've started it in St. Louis, Missouri, and I've been working with a few Singapore students. But to really make HOPE impactful all over the world, it'd be really essential for everyone in different parts of the world to join us so that we understand different issues and perspectives of different regions so that we can adjust and implement newer projects. Our process is simple. Right now, we are in the first stage of observing, researching, and understanding about issues in poverty and planning. What can we do to make a difference? But next, we will start gathering people and making that difference that we want. And based on different situations and results, we will adjust and move forward. These are my sources, and before I end, overcoming poverty is not a gesture of charity. It is an act of justice. It is the protection of a fundamental human right, the right to dignity and a decent life. Thank you, and feel free to contact me at any of these social media or email. I'll be there.